Welcome to Creative Caregiving and Beyond. More and more people are having to become caregivers for their elderly loved ones, and navigating this journey can be really difficult. This podcast will provide guidance and give practical tips for your family. Your host is Wendy Whiteman, elder law attorney, author, speaker, and leading insight advisor in senior protocol and senior lifestyle trends. Know that you are not alone in getting the help that you need. Let's get started. And here's Wendy.
Well, welcome back to another episode of Creative Caregiving and Beyond. And today we have a special guest, Belinda Hawkins of BHawkins Consulting, where they're bridging the healthcare gap between excellence and senior advocacy. And Belinda, welcome.
Thank you.
Belinda, I was just kind of reading about some of your information on your website, and I know you're the founder of your consulting company, and you have quite a vision. I'm very impressed. Today I want our listeners to hear a little bit more about your experience over 2 decades and your journey in founding BHawkins Consulting. How did that happen?
You said we only had, a half hour?
Well, go ahead and tell us your version. Yeah, we'll make time.
It wasn't planned. So I started out 23 years ago. I started out as a nurse aide in long-term care. And then started passing some meds and eventually moved into being a hospice aide. And someone took me from there and put me in an office position in admissions. And after about 6 months, I was bored out of my mind. I had mastered the role, and the administrator said, "You need to be a marketer." I said, "I don't want to be one of those people." So I started, they basically threw me in, and the journey, a lot of people say, well, it started there. Yes and no, because it started when I was taking care of my dad when I was 15.
Okay.
And so I knew I wanted to do something, but it's like I didn't know what.
Right.
And so going into long-term care initially, I was like, this is it for me, right? I'm going to take care of people, and I enjoy this.
Right.
And so different people just kept getting kind of dropped in my way.
Okay.
And it was I never got the easy cases. Like I would get the homeless person from the mission who had a check and they had some kind of insurance and a grocery bag full of medication, but I didn't have any paperwork. I didn't have. So it started with patients like that. And then what I noticed is it just over the years, I would get those hard cases.
Right.
But the end goal for me was, this is tough now, but I'm gonna get them somewhere safe.
Yeah.
You know, maybe I can't help them, but I know someone who can. You know, you don't need me, you need. And that's kind of how it started. And it just continued to where it became Call Belinda. Call Belinda. And one day I sat down and I said, there's something, I'm missing something. And I started kind of putting the nuts and bolts together, and I was like, well, it's kind of a baby. I'm going to throw it out there and see what happens. And before I knew it, it wasn't just, a lot of people think about consulting with big businesses, this company just isn't making money, so how do we fix it? Well, I can help you fix that, but you got to start at the bottom. And so I started doing a lot of training with people, and with training and people that go into roles like mine initially, like sales, they're not all a good fit. And so a lot of that was transparency too, because if you can have a degree, I don't knock degrees. Right. But just because you went and got a degree doesn't mean you can do the job.
Exactly.
And so
that's so true.
So it became more about let me look at your teams from the bottom up. Let me see where your mind for your salesperson is. Like they need to start in a nurse aide position. They need to do something with people in those settings to be able to understand how to help them.
Yes.
And so when it started growing, then it was, well, help me develop my team. Well, this one's not going to make it. This one might. And so it became directly trying to impact the people that were directly being in touch with the people I couldn't help.
Right.
And so these sales teams started growing. I think at one time I had 23 underneath me, and it was a beautiful thing because the one thing I told them is don't do it the way I do it. You know, who people see during the day when you're on the clock needs to be the same person you are when you go home. Like, your motive needs to be pure.
Yes.
You need to be genuine every step you make, because we don't deal with, that's the other thing. When I started, we had like the seniors with the hip fractures, and the seniors that just couldn't live at home by themselves anymore and had memory care, and that's evolved.
Right, it sure has.
It's not like it used to be. You have a lot of people who just had a really bad run of bad luck for a really long time.
Right.
And so it's just kind of, here we are. So sometimes it'll be someone that needs me to look at the actual company, and a good sized company, and I can do that, and we do audits and assessments and look at teams. But then sometimes it's just salespeople that'll reach out, and I have one now, and she's just like, I want to do this, and this is why, but I need help, and I can appreciate that.
Right.
And so to watch them grow and then be able to kind of cut the umbilical cord, and they're like, no, I'm like, yes, yeah, go on.
You're ready.
Good.
Yeah.
You're ready. And so it could be, I just kind of have to shift and navigate as to who needs me. Where am I needed now, and prioritize that, and be extremely transparent and realistic, which is not popular with a lot of people.
Yeah.
So.
Well, and that's what people need to grow. That's what we all need to grow, to be told truthfully where we are and accept that, and so we can go further. And you mentioned the hard cases, and I know how that is as a elder law attorney. I've gotten a lot of hard cases, but those cases do help you expand your knowledge and you become creative in solving and getting solutions, solving problems. Yeah.
Extremely. I've had everything from the little senior who was just confused and lives alone and has put the bag of sugar, on the stove and turned it on. And then I've had, methadone addicts, and I've had heroin addicts, and I've had, the 22-year-old HIV patient. And I've been able to really kind of help different age groups, different settings, whether they have money, they don't have money.
Right.
A lot of them don't understand. Not only do they not understand the levels of care, they don't understand insurance. They don't understand what Medicaid pending versus SSI pending is.
Right.
There's so much that needs to be educated on that so many government entities and agencies in general just don't educate on.
No, not at all.
They throw a bunch of lines out and expect people to know what to do with it, and they don't.
That's so true. That is so true. And I remember when I was a prosecutor, and I prosecuted Medicaid fraud, and I would ask, why can't we just educate the community, a little bit more on how to stay out of trouble, especially when applying for Medicaid and resources. And it just, that was not a priority at the time. So my firm today, we try to do that with our educational process for sure. And one thing you mentioned, being a caregiver for your dad. So were you actually his caregiver, and how long did that take place?
So my dad, he was a construction worker for as long as I can remember. Well, he was shot when I was 15. And so he went from being this active man on a roof to being a bedfast quadriplegic overnight. And our family dynamic was a little different in general, and so it kind of became it was me, let me, I did everything but change him, because that just wasn't an area either one of us were comfortable in. But when it came to turning and feeding and pulling him up, he was a smoker, and that was a whole nother world for me. It was one of the hardest things I ever did, but it set the stage for me to say, I don't want to say I didn't enjoy it. I was happy that I was able to care for him and make things a little easier in a very challenging situation. And that was the part that kind of grabbed me. And it continued. It's been the strangest thing when I talk to people about my healthcare journey, because it always starts with my dad. But, it moved on into, my sister. My sister had cancer. I lost her several years ago. I did her end of life at her request. Also the one that said, hey, do we really want to continue with chemo? Like, are we looking at quality or quantity here?
Right.
Because we've been doing this 3 years.
Right.
Had I not been in the position I was in and been able to get this knowledge and work through things, I would have never been able to have that conversation.
Right.
And my mother, that was a whole nother, we were dealing with pulmonary issues. She went on hospice, she passed. You know, grandmother, didn't really have a good dynamic there, but you know what? It wasn't about that. It was about how do I get her taken care of?
Right, right.
End of life there. It's my uncle. Like, it just kind of became what I did. And it was, I was the first call. And after a while, you're just like, this is just the way it is.
Yeah.
It's trickled over into my husband's family. You know, it's he has several aunties, and it'll be call B. B will know what to do.
Right, right.
Sometimes it's Medicaid.
Yeah,
You know,
yeah,
and it's
yeah.
you know, don't sell that house, and don't
Right.
no, let's not do that.
Yeah.
And then sometimes it's insurance, and so it's just kind of, I guess, trying to grasp how everything has evolved to put me where I'm at. But when I reflect on it, and you gave me some questions, like when you sent that email, I looked at them, I was like, these shouldn't be hard for me. Like, but it makes you think,
It does.
because you do so much and the years pass so quickly that you don't think about everything
Right.
you've done and all the people that you've been able to help. And the knowledge, that's where you realize how much you
Yeah,
know.
that's true.
You're like, oh, I do know that.
Right.
You know, I didn't know I know that.
Yeah.
You know, oh, this sounds good, you know, or so, you know, here we are.
Well, and the journey is training. I mean, that's where the training and the preparation is, like you were talking about, is the journey, that whole process, that day to day, and it doesn't seem like it's spectacular or anything like that. You're just helping people along the way. But it's amazing training, and I can tell, you know, you have a heart for it. This is not a situation or a role that a person could even sustain as a caregiver, you know, as a connector, as a person who's reaching out to help, and still come out the way you are. I mean, there are caregivers that break, and I understand the weight of being a caregiver. You know, my mom's 93, and I'm her primary caregiver, so I understand the weight. And you've helped so many people, you know, personally. That's amazing, and you're still going. Most people are trying to get out. You know?
I tried to get out, and it was, I did it for 8 months. I left. I thought, you know, I'm burnout. I had been at the 20-year mark. And I sat down, I said, I haven't taken a break. And personally, professionally, I was just tired.
Right.
But it allowed me to kind of reset. Because like we talked earlier, I was 8 days into this 30-day do something different.
Right.
And I was like, maybe I'm just detoxing it. You know, maybe I'll give it the 30 days and then 60 days. And by 8 months, I was like, God, this isn't what I'm supposed to be doing.
Right. Right.
And it was just like getting back on the bike. Like, I had never skipped a beat.
Yeah.
But with my dad setting the stage, I barely was able to graduate high school, mainly because all of that had happened. It was never a grade issue.
Yeah.
Which also meant, guess who didn't go to college?
Yeah.
And so when I decided, I was like, you know what, I want to do something. And I went and got my nurse aide certification. When I went into long-term care, I thought that was it. I was like, this is what I want to do. I loved my patients. I didn't mind working the double shifts. I didn't mind my heavier, I didn't care about what the patient had or what the needs were. I just knew I loved it. Until someone brought it to my attention that I was going to kill myself because I was trying to raise 3 girls and work for, sadly enough, $7.25 an hour.
Yeah. Yeah.
And I thought, yeah, but this is it. This is what I like doing. And so it was all about, I think, the right people just literally being put in the right place at the right time.
Right.
I had a lot of really good mentors, a lot of people who've seen things in me that I definitely didn't see. I was like, oh, whatever, you're talking about someone else. And those people, I'm still connected to a few of them.
Yeah.
And I talked to one today, and he's like, to watch the growth, because he hired me as a nurse aide, sight unseen, for hospice. And it's like, everyone's seen it but you. And I still don't see it. There's still times I'll be like, no, this is just what I do.
Well, that's the great thing about mentorship, though. You've got someone in your life that can speak into your life, and they can see things that you can't see because you're so close to it, and your gifting is so natural to you. It's easy for you, and you don't think it's a gifting, but other people can see that. Yeah.
Glad somebody else did.
Well, you on your website, you said you had services like strategic growth consulting and care navigation support. Can you elaborate on how that affects, I know, the facilities and families?
So there's a lot of gray area with healthcare in general. You get people that think it's very black and very white, and it's not.
Right.
And it's the gray area that no one educates on. And then they just kind of say, I don't have time to deal with this, or don't know how to deal with this, don't know how to fix it. And they just kind of push it to the side.
Right.
So one of those things is like levels of care. I've worked in all of them. So you get people that they don't understand what long-term care is and the financial piece to that.
Right.
They don't understand how to use their health insurance.
Right.
Or the fact that they just can't pick up the phone and call a facility and say, hey, I have whatever insurance and I need some therapy. Well, have you had a hospital stay within the last 30 days?
Yeah.
No. Why do I need that? I thought I could just use my insurance to come in.
Yeah.
And helping them navigate through that and trying to, maybe they're not home health appropriate. I've gone up and seen stage 4 liver failure patients on a hospital floor as a home health rep and went, why am I standing here? And those particular patients, the palliative care teams in the hospitals have gone up and tried to educate. The problem with that is the education, it needs work. And so dying patients don't want to hear that they're dying. They already know they're dying.
Right.
What they want to know is, you're coming to me about hospice. I don't know a lot about hospice. What I know is I'm going to die. You're going to pump me full of medications. They don't know that those medications are only given when the body's already shutting down, and they just help the process. They don't know about the nurse they get. They don't know about the social worker, the nurse aide, been there, that's going to get to see you 5 days a week, and you're going to tell things to that you may never tell anyone else.
That's true.
They don't. So those level of cares are so important. Understanding the insurance. Do not opt into this Advantage plan because you're not going to be able to have your choice of facilities.
Right.
You're not going to be able to just go. You can pick a home health. Every home health takes Medicare. You don't have to just stick to the 3 or 4 that a resource is giving you. Your premiums. Yeah, the premiums are higher with Medicare, but you get what you pay for.
Right.
It's. So when I say strategic and bridging that, there's so much that can go into it. Going over assets, because I have worked with a Medicaid attorney and for one, you're over-resourced. You know what? It's not all about a facility getting all of these funds that you have.
Right.
Your house needs to be protected.
Right.
Let's get that ladybird deed. Let me talk about that.
Exactly.
Yeah, it costs, but this is why it's important.
Right.
And so what I've had to learn with that strategic movement is the critical thinking skills that come with that, that can't be taught. Listening, to be able to respond appropriately and be able to direct them in the right direction.
Exactly.
It's just, there's so much education that's not done. And people don't understand with facilities, whether it's just a long-term care facility or a skilled nursing facility that does rehab, they don't understand the options they have, but they also don't understand what to look for.
Right.
You get a lot of facilities nowadays that when you go on the CMS website, they'll have a 1-star, big red hand, those type of things, and people immediately go, oh, I'm not going there. Instead of doing a deep dive and being able to understand, the state now hands out IJs like they're candy. You can get a deficiency for pretty much anything nowadays.
Okay. And what's an IJ? So for
it's
those
an immediate, it's an immediate jeopardy deficiency. So an example of one of those a facility may get is if you have a patient who wanders in a facility and they actually get out and elope.
Right.
That could result in one. I've actually been involved with a facility who used to have these big coffee urns in the dining area.
Okay.
You think, that's great, right?
Yeah.
The residents have access to coffee all day.
Yeah.
One of those residents got a very small drop on their leg, and it caused a little burn. It's a self-report, which means the facility has to directly report it to the state.
Yeah.
And write a little report up. That facility got an IJ, an immediate jeopardy deficiency, for that burn. And so you have to really kind of take the time. I tell people all the time that call me, tour the facilities.
Yeah.
Go tour, ask questions. See if the staff makes eye contact. See if they speak. Is it clean? It may be old, but is it clean?
Right.
Don't look so much at cosmetics, because I've had patients go into brand new buildings and the families call and they go, oh my God, this is awful. So it's really taking the time to educate and say, this is what you need to look for.
Yeah.
Pay attention to this, but don't pay attention to it.
Right.
Know what questions to ask. And I have some that'll go, let me get my pen and paper and let me write these questions down. And they will. They'll just go through and shop. And then they'll follow up with me. I can't help you. I know someone who can, And so every day's different. No 2 days are the same. That's what I'm going to say.
Now that's true. That's true. It is truly evolving. That's for sure. And you have a unique solo approach that you talk about. How does that benefit your clients? Your approach? And I think you've already been elaborating on some of that too.
With the actual, like the patients and families.
Yeah. Yes.
First of all, it's asking them, of course, who are we looking for placement for? And then the probing questions that usually come after that are, are we looking at a long-term situation?
Right.
Are we looking at short-term? Are we looking at an inpatient setting? Or are you looking more at trying to keep, your loved one at home?
Right.
And that's usually my starting point to kind of figure out what level of service that we're looking at. And then, then we go down into what type of payer are we looking at? If we're looking at a short-term rehab stay, then we need to look at, has there been a hospital stay in the last 30 days?
Okay.
If they haven't, but I really need to get her somewhere because I've got cameras all in the house now, and Mom has already tried to burn the house down twice, and she's let the dog out. We probably need to look at a memory care unit.
Yeah.
And being able to understand the diagnoses and being able to shift like that. So they appreciate the education that goes. It's not so much looking at someone and going, where can I get you for me? It's more about where can I get you, where do you need to be, where are the needs going to be met, and how can I make this as easy as it can be for you?
Right.
Because I had a gentleman I spoke with a couple days ago looking for placement for his mom. And she has memory issues. Okay. There's been some issues in some other facilities that really aren't bad, but if they're on paper, they can look bad type situation. And, he broke down crying and he said, there's so much that I didn't know going into this. And he said, I wish someone had told me I needed a durable power of attorney before my mom couldn't sign one.
Right.
I wish someone had told me we needed to put a ladybird deed on the house before Mama couldn't sign the paperwork. I wish I had known that gifting that $1,000 over to the grandchild for their birthday was going to hurt in the end because now Mama can't explain it.
Right.
That's just one scenario that you can deal with in a week.
Yeah, that's so true. That is so true. And we, and that spurred me on to write my book, Creative Caregiving and Beyond, and this podcast, because those are the questions I got most often. If I'd only known. Yeah. And so I was just trying to answer those questions like you're doing, every day. So people will have some guidance, and it is an educational process. But I bet that most of the people you're dealing with in those families, it makes it easier, would you think, to make a decision? Those are hard decisions, where mom or dad or their loved one needs to be located, maybe not home, but in a facility. But at least once they get educated, they may feel better about the decision, once they have all the information and all the alternatives.
They do, and you can see it, a lot of times you can just kind of see them relax a little bit, and they'll exhale. A few years ago, my husband's uncle, he'd been a pastor for years, so cognitively he was always there. People were used to him just being on point.
Yes.
And one of the other aunties had mentioned that there was maybe some issues going on. Could I reach out? And I did. And we talked about sundowners. And she said, no, we're not having any memory issues. And he ended up in the hospital. And I went up, my husband and I went up and visited, and I waited until around that 2:30 window, 2:30. When we got there, he knew who we were. He could tell the nurse's date of birth and his name. Well, once 3 o'clock hit, they come in and asked him his name so they could leave his dinner tray. He couldn't, he had no idea. And that kind of laid the groundwork for me to kind of begin helping my aunt navigate towards acceptance. Like, here's the foundation. This, you've seen this. And being able to start her there.
Right.
To see what was going on and really educate on what sundowners meant, and how, as both of them being aging seniors, like, this wasn't a good situation for either one of them for her to take him home. She pushed back on long-term care placement for a while prior to that particular day.
Okay.
And then she had some time to think it over, and then she called. She said, okay, I think we need to find a place. But then we had to work on the Medicaid pending, because there was a lot. The folder was like this.
Right.
But being able to point out a characteristic to lay the groundwork for her and begin to educate was where everything started. And after a couple months, she's like, I'm just so glad I did it. She wasn't like that in the beginning. She didn't know.
Right, she didn't know. She didn't have enough information to know.
She doesn't. And that's one of the challenges I think we face in healthcare in general, because again, it's evolved. So you have an influx of patients in places like hospitals. And what's sad to me is, because these clinicians have so much on their plate, is they don't really have time to understand each patient. They don't have time to be able to know that this patient's homeless, and you're about to put a 74-year-old back out the door on the streets who's never been homeless before until a week ago. You don't, there's that gray area.
Right.
It's, I got to get them discharged because administration says they got to go. And so being able to educate on those levels, I think inevitably is going to be what helps seniors and other people, because they're getting younger that are needing placement.
That's true.
You've got to take time to get to know them, though, or you don't know. They're a medical record number, they're a name, they're a diagnosis, they have an admission date, a discharge date, and the insurance has said you got to go. And that's where it stops. And that's across the board. It's not just in one hospital or one rehab facility, or it's across the board.
Across the board,
So that, but it has to start at the top, because one social worker can only do so much.
They can only, and they're already stretched thin.
They're stretched.
They really are. They
case
really
managers, one case manager can only handle so many. And then, they'll get to a point where, okay, I'm trying, but now I got 20 that have to go instead of 2. It has to start at the top.
And you've helped develop memory care programs for institutions, facilities. How is that different when you develop a program? I know there's going to be a difference here. How's it different than most facilities?
Some people believe that a memory care unit is the same as that secured unit. Let's navigate to secured unit. Some secured units are strictly memory care. Some deal more with behaviors. They are 2 completely different sets of patients. So when you look
Should they be placed together?
It's not ideal. Your memory care patients, I consider those, some of them are just pleasantly confused. So they just don't, they're just pleasant. They don't know anyone. They don't know themselves. But they're just pleasant. You have some that will gravitate from, maybe they've been this pleasant person their entire life, and now, fast forward, they're not the nice person that you knew. So putting those memory care patients together It helps create a calmer atmosphere for them because you are, the other thing is staff. Your staff has to be educated on how to actually deal with a memory care patient. Behaviors, you never turn your back on a behavior patient, ever. Because there's too much that can happen. When you're dealing with memory care, it's similar, yes. I never turn my back on a memory care patient, but the setting is different. So you're able to really do education with the families that, you know, they want to come sit with mom. Mom doesn't know me. You take a basket full of clean handkerchiefs and you set it on the bed and you just fold clothes with mom. You may fold those handkerchiefs 300 times. You may sit there 2 hours. But the one void that's filled is you're getting the quality time with your loved one, doing something they know to do. Being able to say, this man was a mechanic for 40 years. He'll remember a wrench. Let's get him a toy tool set. You and Dad can sit in the room and play with that toy tool set. Maybe they like to go grocery shopping. Let's set up a grocery shopping unit in the unit itself to where they can, it's children's stuff. They don't know any different though. It's just what they know. I'm gonna go shopping. I'm gonna do a load of laundry in this kiddie center over here because it's familiar to me. It's being able to put the shadow boxes on the wall because they don't know the 80-year-old in the mirror, but they know the 20-year-old. They don't remember their current husband, which is one of the saddest things that I've run into. But they may remember their first husband who was in the military that didn't come home. They may not remember you're their daughter because you're dealing with short-term memory versus long-term memory. And so being able to keep true memory care patients in one setting allows the proper education for the clinicians that are caring for them. The proper education to be able to develop support groups for that particular set of families or loved ones that needs to know, how do I navigate this? I don't want to just not show up. And so you're able to really kind of put the love, plug the right people in, because over 23 years, I've seen some warm bodies that honestly had no business being in healthcare. You know, I started in memory care. That was when I went into long-term care as a nurse aide. I went into the memory care unit. And I remember the little lady sitting at the door who, in her mind, she's 5 years old, not 85. She's 5. You meet her where she's at. She's 5. She's waiting on her mom to pick her up from school. You agree with her 100%. Help me become better at what I do now. Because I have that same conversation with families all the time. Mom keeps saying that, you know, she's waiting on grandma to come back. Grandma's been dead 15 years. Don't tell her that. Because I've seen them start grieving all over again. She'll be back from the store. Give her a half hour. You may tell her that 10 times. So you're able to educate on a similar level, even though it's not the same. But then when you can really group them together, they get that added support from one another that maybe the clinicians can't give them.
And they're seeing other people, whether they're realizing it or not, their own age, their own peer group. And but it does require a deep dive into their history. And really finding out about them, being, you know, more personable. It's not a number that you're just running through in your facility, or a number, you know, like in our law firm. We get to know our clients pretty well and their family, because I can't really make a good assessment and recommendations until I know the entire story. Who are the players? Who are we dealing with? What do you guys want to accomplish when we're doing an estate plan or asset preservation? It sounds like you guys are doing the same thing, and what is needed to be done to know how to relate to them.
You need to know the individual, and that's part of that gray area that I talk about. Is, you know, I had my very first nursing home I ever went into in sales. I had a young patient in his 30s. And he had been on a baseball field with his son. He got bit by a mosquito. He contracted West Nile.
Oh my goodness.
He went from being super dad, active, to having neurological issues almost immediately. He was angry. He was throwing people out of rooms.
Wow.
When I brought him in, he was angry, and I knew he was angry. And I walked in the facility one day, and the call light was on. And I watched it. I looked around, I watched it. And I said, how long has that call light been on? And all of them looked at me, and they said, so why aren't we going in there? Well, he's angry, and he's yelling, and he's cussing. And I said, I want all of you to follow me to the door of the room. And I walked in, and I said, I need you to do me one favor. I said, can you tell this crowd of people behind me that works here what happened to you? And he broke down, and he told the story, and they just stood there crying, apologizing. I said, this is where we're missing it. I said, you are going to be a beating post at times. Sometimes you're going to be the only one they have to talk to. You're going to be the only one they have to yell at. And it's not your fault. You've got to stop taking it personal.
Right. That is so true.
But you have to know
true.
why are they angry?
Right.
You know, why are they, maybe their husband died at 75 years and the kids have alienated them. You've got to get to know the patient. That's the gray area that we're still missing.
Yeah.
So.
You're absolutely right. Well, you're the Captain America of senior advocacy. This is really helpful information. So what if someone is? Do you have families where the person cannot necessarily express why they're agitated, why they're angry?
You do.
Yeah.
Especially if you've got a stroke patient whose speech has been affected.
Yeah.
And those are probably some of the more challenging cases. Because, you know, people, especially in the medical profession, they'll rely on grunts and facial expressions. And while a grimace may show you pain, you don't really know what's going on.
Right.
You don't know that maybe they don't like laying on their side. You know, maybe that's why they're crying all night long. Or that, you know, they hurt that left hip maybe back in high school, and so you're putting that pressure on them, and you're saying, well, they're just agitated all the time, and you're over-medicating.
Right.
Those are probably some of the hardest cases. And it's harder for the loved ones to really kind of deal with that too, because even if, at least if you have a memory care patient, and you can sit and do an activity with them of some form, there's an exchange of activity there, where if you've got a bedfast patient who's nonverbal, that's a whole nother issue.
Right.
You know, and I've seen stroke patients that could use a dry erase because they still had maybe the use of one, maybe both hands. But then I've seen some that lost their speech. They've lost the use of both hands.
Right.
Mentally, they can't use a dry erase board because they can't put the thoughts together to be able to put them on the board.
That's true.
And those are you have to be more gentle with those cases. It's almost like a baby. Babies cannot, you don't know what an infant wants.
Right. That's so true.
You know, and I've had to tell people, I'm not calling them an infant. What I'm saying is,
right.
There's a comparison there. There's that equal ground where you're doing a lot of guesswork. And the goal is just not to hurt them in the process.
Right.
And maybe sometimes you'll get to know certain grunts while you're giving care, certain grimaces, but you have to really pay attention. It's not as simple as just going in and taking a glance at the face and then going over and changing them. Well, they grunted a few times. What were you doing though?
Right.
You know, what was it that made them cry? Because they still cry. They still have that ability. And so that's another gray area that we talk about.
So there's a cause and effect.
Yes.
And we have to be really conscientious to know what's causing it, and not just say, well, that just happened.
Absolutely.
And that's just the way it is, and we have to deal with it and just ignore it every day. Yeah.
Because the other thing, I ran into this just recently, life is fast nowadays. So
it is.
Your aging parents, sometimes which mine are no longer alive, so this doesn't really pertain to me, but I see it all the time.
Yeah.
You get busy and you think, oh gosh, I haven't called mom in a week, or I don't really know what's going on with dad. And
right.
I had a little lady that wandered up to me, of all people, and she wanted to use her health insurance. She thought she could use her health insurance to get into a facility. No hospital stay. Well, what if I just private paid a couple weeks? Well, not to insult you, but if you're on a fixed income, that's probably not going to be the avenue that we need to go.
Right.
What really happened? And then you find out that they were paying monthly at this motel that, maybe went now to their daily because now they've either been bought or they've changed the way they do things. Now she can't afford to live there. And then you find out she has a son or a daughter in either situation. And you ask, where have you been staying since you quit staying there 5 days ago? Well, I ride the bus all day. And then I have the bus drop me off in front of a library. But I found out that the library doesn't let me stay there for long. And then I walk down to the bench with my walker in front of this hospital down here, but they don't let you stay there long either. And then I find a little place where I can sit and rest for a couple hours. You've not been on the streets before now. How much does your son know?
Right.
Son didn't know she was on the streets. She was too embarrassed to call and say, I need a place to go, because he has children and a wife. And I said, I think he'd want to know that his mama is on the streets.
Right.
So I encourage families, and I'm like, life gets busy.
It does.
But I can tell you, my girls, every day, and it doesn't matter if I'm staying with one of them, they're checking on me every single day.
Every day.
And they're busy.
Yeah.
And I tell them, you gotta check on them, even if it's just a quick phone call. If they text, a quick text. If you can only drive by once a week, try to get them on FaceTime once every now and then, because sometimes they're not gonna tell you.
Right. And that generation won't tell you. They're a self-sufficient, independent generation, and that's just their makeup. And so they don't want to burden other people. They don't want to ask for help. And but you're right, we do have to check in. We have to check in on our seniors and make sure they're okay, especially our parents, mom or dad, relatives, neighbors. If we hadn't seen them in a while, I've had my aunt and uncle used to check in on their neighbor. They're seniors, and they would check on another senior. If he hadn't pulled his curtains by a certain time, that meant go over and check on him, knock on the door. Yep. Just little signs like that, just to make sure they're okay. And we tell the seniors in our family, just let us know if you're going somewhere, or keep your phone on, because sometimes they don't put the phone on. So if it's not on, I can't reach you.
That, and they don't check the voicemail.
They don't check. Forget the voicemail. Yeah.
No, forget it. I had one. She says, I don't know what's happening. I said, well, we've got 20 voicemails sitting in here, and some of them are from 2 years ago. So we clear the phone out. Right. But and I tell families, you may not always have the time, but that's where providers have got to do better.
Yeah.
And not just clinicians, like from the bottom up, receptionist, admissions, nurse walking down the hall, if you identify something, is how can we not turn them away? Like, maybe we can't help them, but let's probe them a little bit. Right. To see if we know someone who can, or maybe there's a deeper issue. Because had I not probed her, I wouldn't have known.
You've never known.
Well, there's certain things you look at, like with this little lady, you could see her white bra strap, and it was snow white. Her hands were clean. Her nails were clean. Her medicine bottles were clean. There was something that was just not fitting.
Right. For someone who would be on the street and know where to go.
She's in her 70s.
Yeah.
And so we've got to do better at, I'm busy, but what am I picking up here?
Right.
Attention to detail.
Right.
Ask a few questions. No one's asking you to sit there for 2 hours.
Right.
Sometimes just a few questions and attention to detail will give you enough to say, either I can't help, but I know someone who can.
Right.
I can help. Give me a minute. I'll be back.
Yeah. Yeah.
Instead of just shooing them away because you're busy.
Right.
Because some of that it's going to be there the next day when you go in.
Well, and I think that stems to not just in a setting for someone you're initially meeting, but also with caregiving, when you're noticing that for some reason they're not eating today, or they're not sleeping. They didn't sleep well for 3 days. Well, there's a reason for that. I have this discussion with my caregiver sometimes for my mom. I said, there's a reason why. Let's get to the reason why.
Right.
if she's not sleeping or if she's not hungry right now. She may not tell you why, but there is a reason. Let's find out, and let's see what we can do to fix it. And it's important to just dive in and figure out what's going on.
Well, because another thing we run into is you'll have these behavior changes in our elderly, and I mean, they'll turn into a whole nother person.
Yeah.
Are they dehydrated? Are we looking at a
Right,
UTI?
that's true. That's
because
true.
UTIs will turn them into a whole nother
It
person.
really will. Yes.
Really? Set of lab work and
Yeah.
some good antibiotics
Yes.
will fix the whole situation.
That's so true.
But I've had families that'll go, Mama's having memory issues. Well, wait a minute. And it's a UTI.
Yeah. Yeah.
And so it's that education. But if you don't know, you don't know.
You don't know. You don't know. And, and sometimes in our society, we are quick to jump the gun and say they have dementia, they have Alzheimer's, without asking any other questions, without any other background information. I've seen that happen. And I know when I first started practicing in the elder law sector, I would say 3% of my clients at that point were diagnosed with dementia and Alzheimer's. And now it's like 97%. And so it makes me wonder, do all of my clients really have that, or have they been misdiagnosed, or just someone put it in their chart? Because once it's in there, it's in there.
It's in there.
Yeah.
It's part of the permanent
It's part of it. Yes. Yeah. Well, I love the care navigation support. That is just amazing. And then families need that. I mean, that's one of the things, the number one thing that we come across that families don't know and families need. And so how is that support offered to families for you, for an individual? How would they even...
Call me.
They just call you. Okay.
Usually they'll call me directly. They'll run across, someone will pass off my number, which happens a lot.
Yeah.
There are times I'll get some inquiries, through the website or through social media.
Okay.
And I'll answer those. But there's this, I didn't realize how big the net was until the inquiries
Started coming in.
And then you sit back and you go, wait a minute, this one came, and this one came from here. And that's, like I said, the critical thinking and the prioritizing, because I never know how they're going to get to me.
Right.
I've had my number for years, and I know so many people that they'll be like, oh, this case manager at, this hospital. Well, I may not have talked to that case manager in 5 years.
Right. Right.
And so they come from different areas, but you literally just tell them, just contact me.
Okay.
If they still use email, they can use the email, text message, phone call. If I don't pick up, and I always tell them, I'll call you back. It may not be right now, but give me just a little bit and I'll call you back. So that's usually what happens. It's just, I'm kind of my own, call center, if you
Call
will.
center? Well, we're going to get your information, and I know you're doing a great job, because on your website there's so many great testimonials. And sometimes you can read testimonials and reviews and you can tell that they're fake, but then there's no way anyone would know this unless they went through it. And they are amazing testimonials. So I know you're going to be able to help a lot of families, and I'm going to be referring people to you as well. And I'm sure there are people in our audience that are going to need your services. So how would they get in contact with you?
So they can always go directly to the website, and the email that's connected to that is the info@BHawkinsConsulting.net.
Okay.
My cell number, I always throw it out there. You can call or text it. It's 682-227-1672. If you have Instagram, that one's a little different. That's connected to my pup, but that's consultant with a Frenchie. That one's
Okay.
on Instagram. He's my administrative assistant.
And I love your headshot. We're definitely going to use that with your puppy.
I ran out of time. I said, well,
I
here
love
we
it.
go. It's me and my AA over here. The Facebook is under BHawkins, and I know some BHawkins Consulting. I know some of my older people will use Facebook, but they may not use Instagram.
Okay.
And I do check those messages routinely on there as well.
Okay.
So I've tried to make it as easy as I could. I've had people tell me, just streamline it, make them go through the website, and yes and no, because like we talked about earlier, a lot of my seniors, they're not that good with technology. Some of them are, some aren't.
Exactly.
But if you give them a phone number,
Yeah.
they can use
They can
the phone
call.
number.
That's true.
So if you're great with technology, email me, use the social media. But if you're not, then just use the cell phone.
Use the phone. That's
Yep,
right.
that's
That's
it.
right. Well, thank you so much, Belinda, for coming on. You are a wealth of information. And thank you so much. And I can tell your heart, your passion is there to help seniors and help families. And we need more people like you in the senior sector for sure.
Well,
So thank you
for
so
having me.
much. Thank you. And thank you for listening. I hope you've enjoyed another episode of Creative Caregiving and Beyond. And don't forget to like us and subscribe to our channel. We've got a lot of great content coming up. And don't forget to look in on a senior too. Check them out and see how they're doing.